ophthalmic branch of cranial nerve number 5, that's V1, and cranial nerve number 6, abducens nerve. Yes, there's a lot of nerves exiting right here through this supraorbital fissure. Cranial nerve number 5, trigeminal nerve, has 3 branches. Ophthalmic branch, V1, maxillary branch, V2, and mandibular branch, V3. Always think of it like live long and prosper. 5 on the side because we see on the brain on the lateral aspect of the pons. 5, cranial number 5, and 3 branches, like the old Vulcan mind meld. Ophthalmic, maxillary, and mandibular branches, like doing a mind meld. Sensory input of the face. Let me show you we already saw V1 going through that. You can just barely see it right there. Supraorbital fissure. V2 right here, the foramen rotundum. It's right there. Foramen rotundum and foramen ovale. This is V3. So maxillary and mandibular branches exiting right here. Cranial nerve number 7, facial nerve. See, we like to smile. Muscles of face, taste, anterior 2/3 of your tongue. And think of a balancing V, vestibulo-cochlear nerve, cochlea for hearing, like a C for hearing. This comes out of our internal auditory meatus right here, part of that petrosal portion. Facial nerve and vestibulo-cochlear nerve. Cranial nerve number 9, glossopharyngeal nerve. Cranial nerve number 10, and cranial nerve number 11, spinal accessory. So we have glossopharyngeal, vagus nerve, and spinal accessory, all draining through the same area that your internal jugular vein will exit. I call that the big brain drain. So glossopharyngeal, swallowing, posterior 1/3 taste of your tongue, sensory and motor. Vagus nerve, as many have seen it right here on the cadavers, between common carotid and internal jugular vein, you have your vagus nerve, longest cranial nerve of the body, operating a lot of our parasympathetic branches of our thoracic and abdominal organs. The spinal accessory nerve, remember trapezius, sternocleidomastoideus muscle, that's an innervation from spinal accessory nerve. And cranial nerve number 12, hypoglossal. This is a very difficult one to actually visualize here. Very hard angle to see. There it is, right there. Just barely see it. Right by the foramen magnum, right there. Hypoglossal. There's a couple other things I want to share with you. We can look at facial bones. Remember, cranial bones are the brain case. Facial bones, including our nasal bone, lacrimal bone. As you can see, the upper jaw, we call this the maxillary bone, maxilla. You can see it resides our teeth. 2 incisors, canine, 2 premolar, and 3, as you can see, 3 molars. Alveolar process, just those little raised areas. The tooth socket known as your alveolar fossa. And of course, mandible. A couple others that are more easily shown on this half sagittal cut skull, as we can see. A midline structure would be the vomer, which is kind of removed from here, but you can actually see a little closer into the inferior nasal concha, the middle and superior nasal concha of the ethmoid bone. And here you can actually see the crista galli raised up. I did want to share a couple other features noted here. Frontal sinus, sphenoidal sinus. There's also sinus within the maxilla, maxillary sinus, and ethmoidal sinus, which it's a very pneumatized bone, but we cannot visualize it here, just to let you know. Another pneumatized bone, we call it the mastoid portion of the temporal bone. But that was just to share a few extra things to be visualized on this. Oh, also, before I leave, sella turcica, there's the dorsum sella. Very nice showing.